Infertility, its causes and treatments. Struggling to have a baby is not something new. It's not weird or unnatural, rather a common condition that hundreds of millions of couples go through worldwide. Studies have shown that individuals who have unprotected sex even for an entire year do not conceive. There isn't anything to be ashamed about. Rather, the condition should be met with concrete changes in the lifestyles and diets of couples. Confidence, and if all the else fails, soma expectans. However, keep watching this video to understand the causes of infertility and ways to treat it. Infertility has existed as a ubiquitous condition throughout the world through all lengths of time. No wonder so many ancient Indian, Chinese and African societies came up with supposed cures to treat infertility such as ashwagandha, red ginseng and yombine respectively. Some end up working better than the others, although a general consensus has been reached that talks about focusing on a healthy diet, lifestyle, staying fit and avoiding vices such as smoking can go a long way in helping you have a baby. Symptoms of infertility in men and women. The most obvious symptom of infertility is definitely not getting pregnant. An extremely common and obvious sign that a woman is infertile should be read loud and clear when even after trying for 1 year, conception does not occur. It is usually advised that a doctor be seen if you do not get pregnant as soon as 6 months after beginning efforts to conceive. Other symptoms that act as indicators for infertility in women include irregular or absent periods, painful periods, diagnosis of pelvic inflammatory disease. Women must see a doctor at the advent of any of these symptoms. Symptoms in men also include having undergone treatment for cancer, small testicles or swelling in the scrotum, low sperm count, or a genetic history of infertility, which can be the most common cause. Now, when it comes to causes, we must understand that according to most research done historically, the actual condition of infertility is either equally present in the man or the woman or present in both, divided on a 1/3 basis. In men, the primary causes of infertility are abnormal sperm production due to genetic defects, health problems such as diabetes or STDs like chlamydia, problems with the delivery of sperm such as premature ejaculation, exposure to certain environmental factors such as radiation, pesticides, cigarettes or alcohol, damage related to cancer and its treatment including chemotherapy. In women, the primary causes for infertility are ovulation disorders which affect the release of eggs from the ovaries, uterine or cervical abnormalities which prevent the fertilized egg from being implanted in the uterus, damage or blockage to the fallopian tubes, usually caused by sexually transmitted diseases, and damage related to cancer and its treatment such as radiation and chemotherapy. Having examined the primary causes for infertility in men and women, let us swiftly move on to talking about risk factor or causes for infertility largely under our control. 4 main risk factors are: tobacco usage including smoking weed is known to have a marked effect on pregnancy, as consumption by either party makes it much less likely to happen. Alcohol comes under a similar gambit, although moderate and controlled amounts of alcohol consumed do not make much difference to a man's motility or sperm count. For women, there is no level of safe alcohol consumption during pregnancy or conception. Being overweight or simply leading an unhealthy lifestyle is definitely not a good idea when it comes to anyone trying to combat infertility. A lack of exercise or an unhealthy diet dominated by seafood or red meats is not a great idea either, as these run the risk of heightening infertility and also building up a store of mercury which can have ill effects on the child's developing nervous system. How to combat infertility? The first step would be approach a doctor to receive a diagnosis. They will run tests relating to semen analysis, hormone testing, ovulation testing, and imaging tests. This clears out or confirms any suspicions about whether the individuals are genetically predisposed to be infertile or if they have a pre-existing condition or disease. Couples can also make long-lasting changes to their diet systems, exercise routines, make decisions that will help them have higher chances of conceiving the short run, and general life improvements that also assist their bodies in the long run. As mentioned in one of our previous videos, there are multiple natural methods and foods one can try to improve their chances of conception. Aside from managing and coping with emotional distress as a result of not being able to conceive and have a miscarriage, couples should be willing to accept changes not only to their lifestyle and dietary needs, but also seeking help and being open amongst themselves at the very least. So there you have it. You now know a substantial amount about fertility or lack thereof, its causes, the way it has existed throughout history in the popular Z-gist, ways for you to properly identify signs and risk factors, as well as how to get them diagnosed and sorted out immediately. After watching our other video, you might have also gained some basic knowledge about different foods as well as diverse methods you can make use of to combat infertility the natural way. That's all from us today. We want you to know that your voice is important to us. So please leave a comment below. If you are new here, then click the bell icon for notifications of our new videos and subscribe to our channel.